if our guests could go ahead and introduce themselves from El Paso County Public Health.
Sure, my name is Stephen Goodwin, and I'm with the El Paso County Public Health Office of Data and Analytics. Since COVID has erupted, you probably know us as the people who are behind the dashboards to help us track the process of COVID and then the vaccination campaign that is currently underway. You're on mute, Fadi.
Maybe the volume's down.
We're both delighted to be here this evening to answer questions and to present.
How about now? All right, sorry about that. Hello, everybody. My name is Fadi Okana. I'm an epidemiologist. I work with Stephen at El Paso County Public Health, and as he mentioned, we're very delighted to be here, answer any questions. All questions that we may be able to answer, we'll definitely try to answer. We are responsible for the COVID cases dashboards as well as the vaccine dashboards, and we can speak to those.
Awesome. Thank you all for joining us. If you guys are willing, could we have a little bit of an update regarding COVID in Colorado? I see that there already is a question about the B117 variant in El Paso County, as well as the vaccine rollout. If there's any updates you all have about that.
Sure. We plan to give a high-level update points, both for the cases as well as the vaccines. If it's okay, we can start with those and then move on to questions.
Sounds great, yeah.
Okay, I'll share my screen now. If Courtney would give permission.
Does she have to do that?
Adair is working on that. If you all do have questions about COVID in Colorado, you can drop those questions in the Q&A section and we will get to answering those.
Can you see my screen? Okay. For those that are joining the call but may not have a screen in front of them or maybe dialing in, I am showing our case dashboard. Everyone is probably familiar with this, familiar with the dial framework. We'll be giving a few high-level points about where we are right now, both in terms of the cases as well as the vaccinations. Right now, our incidence is at 125. It has been between that 110 and 145 range for a remarkably consistent time for about 2.5 months. Our positivity right now is at 5.9%. I'll be moving pages to show you a little bit of a longitudinal look at it to display what I'm saying. So our positivity right now did for 10 days go below 5%, which what we needed to do in order to qualify for the lower level than we are right now. We're currently in yellow. We would need to move to below 5% in order to advance to blue. However, sadly, the positivity started to increase and went above 5%. So currently it is above 5%. We needed to dip below 5% to get us to blue. The incidence, unfortunately, has not dipped below 100, and we needed to dip below 100 in order to be eligible for blue. As I mentioned before, the incidence has been incredibly consistent. I'm migrating to our incidence page, and you visually can see a period of time here where it's as of a flatline stable level as you can get with something like a COVID-19 incidence. Okay, I'll be moving on to give to have Stephen talk a little bit about where we are right now on vaccines and vaccine numbers. So I'm migrating to our vaccine dashboard. And both of these dashboards we're displaying right now for those that haven't seen it before. They're both public, they're updated daily, and a lot of work goes into the pages. We're always happy to hear any feedback. If a graph can be represented in a different way, we often change our graphs in order to answer questions that folks have. And we'll leave our email in the chat. If anyone has any feedback, we'd love to hear it.
Sure. If you haven't already visited, this is a vaccine dashboard for El Paso County. It's really important, of course. As you know, vaccinations are a way out of the pandemic. And it's a miracle of modern science that we had so many wonderful vaccines developed so rapidly. I've spent a lot of time in supporting vaccine research, and this is really an amazing thing. We have 3 vaccines currently available for use in the United States of America, and 2 more on the way. On this page, it's a landing page, and we apologize for the confusion about the phased vaccination. Remember, the phased vaccination is a consequence of the initial small supply of vaccine. Luckily, that supply is very quickly ramping up. So these phases are going to quickly resolve as vaccine becomes available to more people. Initially, of course, vaccine was given to those most at risk of contracting the disease, or those most at risk from a bad outcome if they did contract the disease. And now we're widening those gates. The 3 numbers that we track for vaccination campaign, they're all interesting in their own right. The top left, we're tracking the total number of doses that are delivered. That's a measure of effort, if you think about it, because that requires a vaccination encounter. 2 of our vaccines currently in use require 2 doses to be fully, to have a complete series. 1 of them requires a single dose. But this number of doses administered is a measure of these encounters. The second people, and very important from the standpoint of disease management, how many people have actually received 1 or more vaccines? And those people then, after a period of time, it takes a little time for a vaccine to take effect, begin to have some immunity that is vaccine induced, which is what we're looking for. And therefore, they're helping not just to protect themselves, but to protect from the spread of the disease more generally. And finally, the bottom number is how many people have actually completed their vaccine cycle. And so at this point, we consider them fully vaccinated. And if we want to, Fadi, move on to the next page real quickly, just to let you know how quickly things are moving. This is our phases page. You can see on the left hand, the 2 left columns are all the phases, all the confusion in current play. And the next phase is wide open. So we're estimating as early as mid-April that we'll be moving to vaccines on demand. That's how quickly the supply is ramping up, which is pretty awesome. And we can go ahead then and move to the next page, which tells you about, it's actually the overview page, really nice, sort of rolls things up. If you have only 1 page to visit, this is sort of telling you where we are. It looks at doses per week on the column chart, and then across the top of the page, it's telling you the facts about these doses, and it's showing you 2 lines to track the percent of the full population that is immunized and the percent of the full population that is completely immunized. There's also 1 data tick here that's rather interesting. All of our data fundamentally comes from the state of Colorado, where we track vaccinations. Every state has a central vaccine registry, and in Colorado, we call that CIS, for the Colorado Immunization, the Colorado Immunization System. I can never remember it. But in any event, fundamentally, our data comes from that. We do have vaccinations occurring outside of CIS. Those are from federal entities, for instance, the Veterans Affairs, Bureau of Prisons, or Department of Defense. They're currently not all funneling into CIS. And so we have some aggregate information from them. So you can see the change that occurs when Fadi toggles ours as a subset of state and federal estimates. So you can see overall, Fadi, if you go, we can see we're above 20% of our population has now likely been at least 1 vaccine dose. If we include all estimates, it's less than that otherwise. Really quickly to the next page, just to show you, there are 2 more pages that are of interest, fundamental, or a couple more pages really. The next one shows you information about the vaccination event. So we're tracking a total of almost 225,000 doses, and you can see them delivered over time on the left bottom. You can tell which vaccine we're talking about, and it's all interactive. So if you hit a vaccine, you'll see all of the charts interact and everything interacts. You can see whether the provider that delivered the vaccine was a clinic, a hospital. Interestingly, a lot of people don't realize a lot of El Paso County citizens are actually vaccinated in clinics outside of El Paso. So you can see about 9.7% of our inoculations are coming from outside El Paso County. And then the dose. Remember, these vaccines, most of them require 2 doses. So you can look at whether this is a first dose or final in the series dose. And then really briefly, Fadi, if you want to show, if you go across, say, to the vaccine, over time, you can see an over time graph by hitting the button. So if you do that, it changes the bottom graph to a ribbon graph. So you can see the effect week over time, which vaccines. Pfizer-BioNTech is the one that has had the most doses administered, followed by Moderna. And then last, at this point, the Janssen J&J vaccine. And then, of course, there are some unspecified. So we have a large data set here, millions of immunizations in the state immunization tracking system. The next page actually talks about people, right? So we're vaccinating people and tells us about the demographic of the vaccinees. So on this page, you notice the count is lower because this is counting all of the people who've received immunizations against COVID-19. And fundamentally, we're showing here again 3 different attributes that we can track when the vaccinations come through CIS. And those are the age category of the people. And again, it's all interactive, and you can see the overtime effect, whether they're male or female, the sex, and finally, race, ethnicity. And again, we encourage everyone then to get vaccinated to provide this information so that we'll have it available to help track the progress and understand where vaccines need to go. The next page is a page that shows you about rates. And the rates are really important, and the rates that we can track are by age demographic. The heavy dotted line is our full population. And you can see right now we're approaching 20% vaccinated. So this page tracks vaccinations. The next page tracks fully vaccinated. And it's a lot of information on this page. And you can see there's a time lag for vaccinated and fully vaccinated because of the consequence of having 2-dose vaccines. And then I think clinics is really a good one to look at. Clinics, one of the questions, now, so far we've been looking at El Paso County citizens being vaccinated. Now we're looking at something that's subtly different here. We're looking at clinics within El Paso County delivering vaccines. So the blue is the doses distributed to us by the state of Colorado to these clinics, and the orange are the doses that they're actually delivering, regardless of whether they're delivering it to an El Paso County resident or not. And you can see that we've made steady progress in moving upward. In the last several weeks, we've had some up and downs because of either a combination of vaccine supply and weather outs. But you can see the trend is completely improving. And the last bars on these weekly graphs are almost always partial graphs, right? So that's tracking weeks from Sunday through Saturday. So that the reason things are so low at the far right of the graph is because it's a new week just beginning. And if on the top right of every page, it tells you the data effective date. You can see this data is as of yesterday at midnight. So this is data we're acquiring from CIS yesterday at midnight. And one other really brief, this is just one of my most fascinating pages. It shows you the history of COVID from the very beginning of time, where blue is the COVID disease process, we're counting cases, and green, we're actually counting vaccinations. So Fadi, if you zoom that all the way to the left, it'd be really kind of cool. So just so you can see within a year of, so back in March of 2020, we began this entire process. And you can see that the first vaccinations were delivered into El Paso County in mid-December. Very quickly, the number of vaccinations we were putting out was more than the number of cases that were occurring. It's quite fascinating. The next graph shows you the cumulative graph, and it's the same kind of thing. We've crossed over very rapidly. So on the cumulative graph, the blue line shows you the total count of all COVID cases identified in El Paso County. And then the green line shows you those El Paso County citizens immunized and those fully immunized in gold. So anyway, it's a really nice display of how quickly we're moving forward. And remember, vaccination is fantastically important for us because it's our pathway out of the pandemic. And with that, we'd be happy to talk and start answering questions.
I think that is a perfect segue into a couple of these questions that I've seen.
Absolutely.
So it's kind of in that getting out of this. Is there a concern about opening up too soon and having a rise of cases, as well as what do you think is the timeline for when we have enough herd immunity in the community? Are those the same? Are the projections similar?
So those are both fantastic questions. Fadi, I know he's smiling because these are the questions, of course, that everybody has. Remember that communicable disease, infectious disease, COVID is just one aspect of health, right? And we've undergone a tremendously challenging period of time where we suffered businesses, closures, people can't visit families. So we know we have to move ourselves out of this. There's always a concern about opening too quickly, right? So opening too quickly when there's a lot of disease in the community is not a good thing. And if you look historically at where we've been, it's quite fascinating to see. Fadi, I don't know if you could show, it's really important to understand where we've been and where we are. So if you look historically at all of our cases, and it's not just us, the one thing we've learned about this disease is that it moves together. So if you look at the state of Colorado, you look at regions, they tend to move together. We've really had so far 3 peaks of disease. And the first peak for us was actually bifurcated. That very first peak was the first time we saw the disease. And if you'll recall, in the summer, we had a second peak. And now, one thing that's fascinating, look at the peak of the summer. It's actually below where we are now, significantly below. So we still have disease in our community. But the fall peak that hit this nation was astonishing in its magnitude. You can see how much larger that is. So in answer to your question, going back to the process, vaccinations help us move forward. Masking, vaccinating are helping us move forward. The more that we avoid close proximity to people outside your household, unmasked, the less opportunity to spread the disease. The more we are inoculated, less opportunity to spread the disease. But we have to balance that against, the concept of a shutdown. We don't want to shut down, but when we look to Europe, for instance, we're seeing now that in Europe, they're beginning another sequence of shutdowns. So we do want to avoid that circumstance.
Thank you. That was very informative. Thank you. Another question that I saw, is there a central website where people can find where they can register to get vaccinated, or is it through different clinics, through employers, through multiple different websites? What's your advice for people getting vaccines, I guess?
With today's age, there's a plethora of information online. As you know, we do have on our site all the information that you would need in terms of vaccinations. There are other websites out there. Stephen, was it Vaccine Finder, which includes some sites, but not all sites. On our website, we do include locations, if you're eligible, so on and so forth. So I would recommend starting with our website. And if that doesn't work, you can either email us and let us know, hey, I'm not finding what I need, or finding these secondary websites that are coming at it from more of a high level, meaning that they're available for everybody. Our website is for El Paso County.
They're aggregating these websites, vaccinefinder.org. There's a bunch of them that have popped up that are legitimate, and they'll help you find different opportunities. Remember, the pharmacies are now doing this. The vaccine consortium within our area is spinning up, and new dedicated sites are coming online. So the amount of vaccine coming out is going to increase very rapidly.
Awesome. And then is there this was a question at the top, but what do we know of any variants that have showed up in El Paso County?
We do. So variation in viruses is completely normal. It turns out that this virus, even though it's an RNA virus, has an error detection correction mechanism. So it doesn't mutate that much, but every time the virus replicates in a cell, it has an opportunity to mutate. And this virus has run so wild for so long with so many people that we're seeing mutations. Mutations have occurred from the beginning. The most dominant mutation, the one that we see is considered baseline, is one called D614G. But in recent months, we've seen vaccine variants that they call them. So whenever the variants start to gather and are identifiable, we call them variants. And these populations of virus can become problematic fundamentally if they become more transmissible, that is more infectious. They could be more deadly. That would be another bad thing. They could escape detection from the tests that we use to detect them, which would make them hard for us to understand. They could escape therapy. And worst case, vaccines could become less effective. So in the United States, globally now, there's about 3 major variants of concern. You hear them, and Fadi, do you have the numbers handy? One of them is B117, originates out of the UK. One of them is B1351, originates out of South Africa. One of them is out of Brazil, P1. And then, believe it or not, US has made the hit parade. There are now two variants that are coming out of California. I think it's B1427. and B1429. And of these variants, the UK variant has been detected in Colorado, the South Africa variant has been detected in Colorado, and the California variant has been detected in Colorado. So these are all in play. And again, they're dangerous for us. They're concerning because if they become more infectious, for instance, it just makes it harder to suppress the disease using masks and vaccines.
Thank you. That's super helpful. Just a quick answer. Does the vaccine make variants less likely to be able to be transmitted and cause serious disease?
Can you repeat the question?
Yeah, sorry. No, absolutely. So the question was, does the vaccine make variants less likely to cause serious illness? How does the vaccine impact the variants, I think is the main question.
I think right now
ahead,
we know that the vaccines are still effective, incredibly effective against the variants. So the answer to that would be yes. Getting vaccinated does help with that. We're hoping and praying that a variant does not mess with that right now. The variants that have been identified, early results seem to show that vaccines still work incredibly well against those variants.
And the one thing, so not only from an individual effect, protecting the individual, yes, very protective. In fact, they've shown to be remarkably protective against serious illness, but also from the communal, helping to slow the spread of the disease. This is where we don't yet fully understand how that's going to work, but so far it's looking very good. It's looking like vaccination is going to help inhibit the spread of the disease and therefore the spread of these variants. Now, some of the variants make the vaccines less effective, but they are still overall extremely effective and very, very effective against serious illness.
Thank you. That helps a lot. And I think we can address one more question before we move on to the legislators and them talking about their legislation coming up this session. I think we should answer how does the county get vaccines from the state, and how does that process work, as well as how are I guess we'll stop there. Yeah, how is the vaccine distribution being handled by the state?
So that we may not be able to answer to because that's a strategy designed by the state. There has been some conversation in the past about a population proportional distribution of vaccines. And what we can say on that is that recently El Paso County is within 5% of getting vaccine to its population proportion. We can only speak on what El Paso County is getting in terms of how that decision is being made. That's not something that we do, so we will not be able to speak on that.
And also one of the mega vaccination sites is being stood up in El Paso County. In addition, vaccine comes directly from the federal government to the system of pharmacies. So there are a number of channels that it comes in, but fundamentally from the state, it's coming in per population. And as you know, depending on how you count it, we are either number one or number two.